Brought to you by GTA, your island, your network.
Healthcare economics is just, it's not easy.
And according to Public Health Director James Gillen, healthcare economics isn't easy, but rather more complicated. It was late last year when Public Health raised concern over the high reimbursement rates when it came to Medicaid and MIP at the Guam Regional Medical City. Reimbursement rates at GRMC showed a per diem at over $5,000, or 4 times more than GMH. This concern led Public Health to only cover emergency services at GRMC and then an eventual notice for termination of its service provider agreement.
Knowing what resources we had available to pay, we were really concerned.
Gillen says the proposed policy change was through the advice of representatives from the Centers for Medicaid and Medicare Services. However, following a meeting with GRMC on Friday, Public Health announced its decision to rescind their earlier termination.
And Friday, GRMC noted and showed us on our own state plan a section that says clients are able to access any provider. So that meant clients could go to GRMC and we could not issue that policy. We asked the federal representative again to clarify, and they still weren't sure whether the policy that we stated was correct.
GRMC in a statement Friday says Public Health recognized that their initial interpretation of their obligations under the provider agreement and the Guam state plan was flawed. So were the feds wrong in their advice?
I don't think they gave us bad advice. They gave us advice that if they had researched it a bit more, they might have said, no, don't do that. Now, we're still asking whether or not that advice, does stand, where we can find in the regulations that we have that option. But we've pretty much agreed with GRMC.
GRMC stated they want to work with Public Health and GovGuam to ensure that quality health care, especially for those most in need, remains accessible. Gillen agrees, adding the nearly 30-year state plan, which lays out how payments work, needs to be amended and will hopefully involve negotiating a lower rate. In the meantime, now that Public Health has lifted all restrictions on GRMC coverage, Gillen notes the expected reimbursements due for calendar year 2016 still need to be addressed. In total, the expected reimbursements for GRMC are over $25 million. Reporting for Guam's News Network, I'm Ken Quintanilla.
Brought to you by GTA, your island, your network.